Very good evening, everyone who has joined us today for this webinar. We will be starting in the next 1 minute. Okay, so very good evening, everyone who has joined us online and who are watching us live on YouTube. All the principals, all the counselors, all the students, a very warm welcome to all of you all. In today's webinar, we are going to give you all insights about the different courses that is offered about uh, uh, from Tech Mahindra SMART Academy. So I'll quickly give an introduction about the same. So SMART Academy offers courses like digital technology and healthcare, and they have an army of courses, and they also aim at creating well-trained youth by providing them with quality training. Smart Academy is Tech Mahindra Foundation's flagship employability program to empower the youth. In today's session, we'll be having two speakers. We'll start with digital technology. We have Miss Ruchi Mahendru as a speaker. She has been in this field for over 9 years now. And at Smart Academy, she provides all the candidates an appropriate training program depending upon their qualifications and their interests. So over to you, Miss Ruchi.
Hi, good afternoon, good evening, everyone. So I'm Ruchi Mahendru. I'll be representing Tech Mahindra Foundation. It's a CSR initiative that has been taken by Tech Mahindra Limited. So it's a CSR, that means there is a corporate social responsibility of Tech Mahindra Limited towards the society, and it majorly works for employability. So I'll share some slides with you so that we can understand it better. Yes. So Tech Mahindra Foundation empowers through education. It has been established in 2007, and there are around 86 centers across 11 cities that works in development. So there are three key segments that it works. First is education. Education is for the faculty, the trainer, for the recent advances to educate them so that they can deliver the right education to the students, right? And then the skill development that we are working for is for employability. So a particular skill is being developed among these students so that they can work. So it is very important for every, we can say every candidate who is looking for an employment. It should start from the very beginning, right? For example, if we have a very good approach towards computers, then we can start taking computer subjects in the very early stages, that we can say in +1. There must be at least one subject that we can work with. Otherwise, if somebody is interested in healthcare department, then he or she has to take one or two medical subjects so that he or she can pursue his career towards the healthcare. And one is for disability. The disability ensures the person ensures a disabled person to pursue their careers. So there are certain different skills that can be developed among these disabled students so that they can pursue their careers. And Tech Mahindra itself uh, promotes at least 10% of people that are working with them. So I'm specifically presenting digital technologies. It is currently, this academy is located in Vizag, Visakhapatnam, Hyderabad, and in Mohali. So there are 4 to 6 months of training program that it contains at least 2 hours of training, including their personality development to ensure their overall development towards their careers. So at present, the courses that we are offering in digital technologies are digital marketing, graphic designing, Java development, PHP, and cloud computing. So even in computers, there are different domains that you can make progress with. For example, if you are good at selling, and earlier we are supposed to do it traditionally by pamphlets, but the era has been changed. You can choose your audience where you can sell your product, where you can, make others make live of what you want to present. For example, some knitting objects if you have, or some kiosk, a small kiosk if you have opened. So within the locality or the people, you can manage in that. Graphic designing is for those who are very good at making those pictures, either at Facebook, Instagram, some logos. That works for graphic designing. Java and PHP for their for data saving, right? For their backend processes. So we do include, it's a full stack programming that includes your front end and back end. Though we are also offering cloud computing. We have a tie-up with Amazon. So we do provide Amazon Web Services. That says that whatever the data you have that in a cloud. So you don't need any uh, what we call, earlier we used to have hard drives, floppy disks. So now we can save our data in the cloud, that is in the memories, right? Not in the form of physical form. Then there will be internship programs as well, and that will lead to your placement assistance. So the skill development that includes, there are short-term skill development courses. A particular skill is being developed among the students. There will be a minimum of fee charges from the market price. There are very few. There will be personal sessions that will be giving to the students so that they can deliver what they know. This is really important. There are certain times when we know things, but we are not able to communicate those things to the required field, to the required person, to the required technology. हम उस पे implement नहीं कर सकते हैं. So personality development is really important for everyone to implement what they want to know, right? So there are scholarship programs as well. So those who cannot do any, suppose who cannot pay, who cannot able to invest in, but are good in studies and want to do, there are a vast number of scholarships that Tech Mahindra is providing. Thereafter, we have placement assistance. Yes, we do have placement. The record has been recorded 75 to 80%. I know it's quite remarkable. So over the years, it has trained successfully over 1 lakh youth with a placement record, as I say, 75 to 80%. So Tech Mahindra Foundation do have a total of 8 smart academies, out of which 4 are for healthcare, 3 for digital technologies, and 1 is logistics that is located in Visakhapatnam. So it has been consistently doing good. Its robust processes, stringent monitoring. It has created a model of scaling up skill development that maintains its high quality standards. So anyone who is looking for a job and who wants to make career and wants a specific guidance, then they can talk to our mentors. they will talk to you, they will understand you, and they will give you the right direction that you must undergo for that. So about digital life, I would say that this current era is grooming, is moving fast in digitalization. So everything you have is your phone, your TV, your lights, your switches, everything it has been digitalized. So it's a new era. It's an era of digitalization. There are new sectors, there are industries, there is a lot of career path that has become the most in demand careers. So smart means skill for whatever is going on in the market, we skill and we place them, right? So career counseling is really important for all those aspirants who are looking for their careers, specifically, not specifically in digital technologies, but in all the segments. So digital technologies is the need of the hour. So we have to make careers. If you are really into computers, then you must come and move forward to grow in digital technologies. You can must come. So the centers that are located in Mohali, some are one is located in Vizag and one is located in uh, Hyderabad. So anybody have any questions in this? Though everybody should understand that it is an era of digitalization and there is a high demand of digital careers. So for any assistance, you can call up on these toll-free numbers. You can WhatsApp your queries. You can WhatsApp we'll give you a back call on this, or directly you can call upon my number. We have you have my email ID as well. So for any queries, you can take up. For the admission purposes, I would request everyone for digital technologies, the student must be a graduate minimum or a 12th pass minimum. 12th pass would be the minimum qualification and highest can be any other. And yes, for those who have already done 12th or is a grad and though belong to a non-technical background and want to pursue their careers in IT, they can. It isn't that we are not doing it or see we cannot do it. हमने अपना BA कर लिया है या हमने 12th arts से करा है, BCom कर रहा है, we cannot go to IT sectors. No, this is not. Everything is very much digitalized, very much advanced these days. You can do certain certifications as well to a high end, from a low end to a high end certifications, and you can also pursue your careers in IT, though you don't belong to a technical background. Raj Lakshmi has asked in the chat box that what is the fees charge? See, the fees, I would say it will be the training course based, right? So all the training, I would say, is placement-led training programs. Okay, it's a short-term program. The minimum is 4 months and the maximum is for 6 months, right? So there are different charges. There are very minimum charges. Okay, you have my number. You can ask for that. There are very few charges. You can also pay in installments. If you are not able to pay, I would say that you do have scholarship programs, right? So anybody wants to ask, please write down in the chats. Wants to ask, I'll answer you. Yes, for the for the non-technical backgrounds, if they want to pursue careers, once again I'll tell, they can either go for digital marketing or they can opt for graphic design, right? So we'll let you know certain softwares that you can work on and you can pursue it. Okay, IT में enter के लिए you must have certain skills so that you can do it. For technical backgrounds is good. For Varsha has asked me, what is the criteria for scholarship? See, for scholarship criteria, that if you are not able to pay, we do have scholarship exams as well. If you pass that, you can also be given scholarship, right? So there are very handsome scholarships that we provide, including you are interested for that, right? And if your attendance is 100%, then there will be, of course, there's a short placement for you as well. So the training plus personal grooming plus attendance will give you a crack in IT. Does the student have creative skills to graphic designing? Not necessarily, but to an extent. See, once you go for any training, I would say either it's graphic designing or it's digital marketing or any other course. See, you need to absorb it, right? You need to love that course so that, see, the creativity itself comes. You cannot, skill can be developed, but creativity cannot be developed. We need to understand this, right? So creative skills, yes, it is required, but it can be acquired, but it cannot be taught. So creativity requires in every segment that you work, right? If I suppose I teach you A, then you have different types of writing A, different types of way of speaking, way of spelling, way of pronunciation. So there are different types of things that we present. That is creativity. Okay, the presentation is creativity. So it's different for everyone. Okay. Yes, there are certain online courses as well, but preferably we provide offline courses because it has more productivity, right? It is more productive than online classes. I do agree there are certain students, there are certain aspirants, they are far off from the places, but and they do not come, right? For certain cases we can do, but for high-end courses, not for the short-term course, not for the lower courses, just because though you don't belong to a technical background, you needs a hands-on practice. Those who are already in it can go online, but who are not aware of the technology, who are new into the system, though they need a hands-on practice. There are highly high-end dry labs we have. You can come, you can have a visit. One more question I have. Do you help with accommodations for outstation students? No, we do not. No. We do recommend you that you can go here in this area, or this is the tentative numbers I can provide you where students are already residing. But we do not provide accommodations, right? Tech Mahindra do not provide any accommodations. We only provide you education, right? Anybody else who want to ask? I know it's quite difficult to say there is no online class, or there are few online courses where I would not say कि सारे online है या सारे offline है, but most of them are offline. And if you are looking for a training purpose, you can most probably come for offline, right? Say it's difficult, if it's difficult to come, but on the other hand, it will be easier for you to grab things, because physical presence means that you see, even though personality development classes, they give coherence, right? The way you speak, the way you ask, the way you do activity, the daily etiquettes that the day-to-day change in the life that comes with these classes. So that can only be seen in the physical way, right? For online courses, yes, but I do prefer, for the technical background, should go for online courses. But still, if you are going to learn something, there should be, some hands-on practice would be there. Anybody else want to ask? Please, directly you can chat or you can send messages. There are different sectors in IT. You can choose any. We have this. Later, we'll be providing more. We're providing more courses who are in the trend. For example, we are about to introduce machine learning. We are going to introduce this ethical hacking as well. So we are looking for more number of courses which are going good in the market. Any other question? Any other question from digital technologies? Anybody else want to ask? Can you provide few courses in Digitech? Few courses, as in, if I would say, we do provide courses. See, yes, I would say that, for example, if I would say digital marketing, right? So there are different paths of different topics that covers digital marketing, right? Though particularly on a certain thing that you can grab a job. ऐसा है. Well, for example, if I would say about a digital marketing, the whole digital marketing is required, yes, but if you there are certain topics, if you cover, you can grab a job as. We can give you placements for sure, right? Even though full stack development, there will be a front end and back end. Only front end can also provide you job. Though we provide both, though we provide full stack. Any other question? Anybody else? So I'm getting certain queries about digital marketing, right? So what do you cover, right? So I would say in digital marketing, we cover SEO, SMM, ORM, blogging, Google Analytics, Google and Bing ads, affiliate marketing, email marketing, HTML, CSS, WordPress, Adobe Shop, right? These all are being included. So individually, if you go for SEO, you can get a job. For SMM, you can get a job. But we as a whole will prepare you for digital marketing, right? What else for? Anybody else want to ask? Okay, I have one suggestion for you all. See, though in the classroom, right, whenever you are in a college or in your school, don't cram. Just try to understand what they are saying. Link it, right? Link it either with your daily activities or when you do something, link it with yourself. Okay. So in this way, you somewhere will absorb it, right? Sometimes we do feel that we do not know things, but that is somewhere adhere in our mind, right? And it comes out when we need it. So sometimes we used to say, ki, I do remember, I have heard, I have learned it somewhere. So this is somewhere, right? So understand your lectures, okay? Understand it, link it, it will eventually itself will come out of it, right? This is, I would say, creativity. Okay? What you absorb, when it come out from you, it is the creativity. Okay? So whatever is taught, do understand, especially at the college level. Understand. The very basic of the language is C, C++. Understand that. What it is, how it is, what is the programming, why we do that, what are the rules, right? What are the softwares? You can also make your own applications. Why not? If you're looking for ideas, there are n number of ideas. There are n number of ideas. You can make your own. So I believe there are so many students who are very good at gaming. Why don't you make your own game? You have n number of friends. Unke saath mein you can play. You can share, right? So slowly and steadily, when you start doing it, you will continue doing it. Irrespective, you like it or you don't like it, you eventually will run on it. I believe games, 90% of students like, right? So make it your career, right? Be passionate of what you like, do what you want, make a career on it, right? One thing I again want to repeat, through certain certifications, you can enter IT sector and you can groom over there, you can emerge, you can do a lot of things over there. So please don't get disheartened that don't belong to a technical background and you cannot enter IT. You can. You can. Search for it, come for us, we'll educate you. Right? So any questions? Once again, I want to say if you want to ask anything. I believe I have covered most of it. Anybody from the technical background who want to ask, who is interested in computers or anything? Anybody else? No? Okay, I'll continue. See, digital technologies is so much in this era. It has been arising, it has been emerging. With the population, it's also increasing, right? So the career opportunities are also increasing. Once you enter into the IT sector, you will get to know there are a lot of courses that you can do. Lot, a lot. Just for those who do not belong to IT sector or who have not studied computer till 12th or in graduation, right? For them, it is very important to learn. It's very important. Do certain courses, right? If you need my help, just call me on my number, or you can text or you can email me, right? So I'll suggest you. So don't go for any course, go for the course of interest, right? So if you have the course of interest, then only, or I would say most of the times, you will emerge in that. Okay, so please do understand whatever is taught, listen it carefully. There are certain basic things that we learn in the classroom, and it lasts long. So you must have certain basics of it. Not much, I would say. Just understand at college level what is HTML, CSS, WordPress. That is it. Basic of it that you should know, right? For up to 12, you should know a lot about MS Office. This is again very important. How to make presentations, how to operate Excel, how to use Microsoft Word. This is really important for all of you. Make your own PPTs, right? So yes, one thing very important. For those who want freelancing in digital marketing has a great scope. Great scope. We will teach you blogging, right? The platform, blogging itself, how to write, how to express your emotions, how to express your thoughts. That should reflect in a fine writing will also teach you. Okay, so there's a lot of opportunities that you can pursue in digital technologies, right? Anything else? Over to you, Lalita.
Thank you so much, Miss Ruchi, for giving us all that information about digital technology at Smart Academy.
Thank you, Lalita.
It was really amazing and wonderful and enlightening.
Thank you.
Okay, so we also have Dr. Nidhi who will be joining us shortly. So if we could all wait for maybe a few minutes, she will be talking to us about the healthcare part of Smart Academy. And post that, again, we will be having a Q&A for the healthcare courses offered by Smart Academy. All right, so probably in the next 5 minutes, we'll be starting with that. So please stay back and we'll start with it soon. All of those participants who have joined us on Zoom, uh,
Hello.
yeah, so you can post your queries on the chat box, please.
Thank you, ma'am. This is Rajneesh. If you can hear me, while we are waiting, I can share some of the related experience, which is useful to the audience. I'm a IDC counselor, and I have completed my training with IDC, and I work from New York in USA. And as ma'am earlier explained regarding the use of technologies, I wanted to share my personal experience also that number one, that even if you have not been in the area of technology, don't fear it. You can learn it at any stage. It is absolutely open. We come across all kind of different age people who have learned the computers and related tools to use it. And they are a big support in raising your income. They are the tools like your personal assistant. They really are, and they help you quite a lot. I think a lot of people who already use Excel or Word or PowerPoint or these days there are a lot of other tools in managing your own, organizing yourself, maintaining the contacts and all that. All those are very, very helpful. They work like a additional assistant in your life and help you move fast in getting things done. So it has tremendously helped me also grow out here in America. But at the same time, back in India also, a lot of our friends are growing with that. So number one, the technology can be learned at any stage from any background you are. Number two, it is just like 20 years back, it used to be about English as a language. If you didn't know English as a language, it is very hard to work on the jobs and grow. Similarly, now the IT technologies are like the language of the job. If you know it, you can work on it and grow fast. Yeah, and I did counselor program with IDC, and I've been working with a team of counselors back in India, and there is a lot of opportunities. And the good thing is we are constantly being guided by experts like today, and we must take the advantage of that. And it is a huge opportunity to guide people to get to the right college, which is suitable to their career. And use of technology certainly makes a big difference. Thank you.
We will be taking another 5 minutes at the most. There has been some technical issue due to which the speaker is not able to join. But till then, if Miss Ruchi, if you would like to continue, please do so. Giving us a few more information about digital technology till then.
Sure, sure. I'll repeat certain things for those who have joined later. Okay. So once again, I would say it's the era, and you must take the most of this, most of the advantage of this. If you want work from home, if you want to work from the remote place, you can work. There is a lot of opportunities in digital technologies. I truly appreciate the previous speaker that he shared his experience. Though I believe that if anyone wants to share their experience with digital technology, please come up. I would love to hear their stories. Is there anyone who wants to talk? Okay. See, I'll give you certain examples. For example, you are looking to make career in digital technologies. You do not belong to any technical background, but you want to explore things, right? You want to make career, you want to go forward in it. Then you can take digital marketing, right? Digital marketing, you can work for digital marketing, you can do freelancing, you can teach that as well, right? So certain things will give you jobs, okay? If you do one segment, you can get a job. If you do other segments, you can get a job. The whole course is not important, but you should know the overall picture of it, okay? So Java full stack, there will be PHP full stack. We have graphic design, we have digital marketing. There are different eligibility criteria. Okay, so so all the courses that we are providing are placement-led training programs. Okay. Please, you can put your queries in the chat box. Anybody else wants to share? Also, if you are not able to choose your career, you are not able to choose which line you need to go and make career in, or if you are not able to, if you're not able to see which line is good for you, then you must come for the counselors. They will help you definitely. Though your point of interest is really important, because the point of interest will make you career.
Hi, we have Miss Jaya here. She will be giving us insights about the courses pertaining to healthcare at Smart Academy. So, over to you, Miss Jaya.
Uh, Good evening, everyone. Am I audible? Thank you so much, Ruchi. Thank you so much, IDC, for giving us this opportunity and to share about our courses. So I think Ruchi has mostly covered about the digital academy, and she has given a brief about what Tech Mahindra Foundation does. So as she has mentioned that we work into three sectors. One is employability, disability, and education. And our basic objective is giving employability through education. Dr. Nidhi will also be joining in few minutes. So I'll just take you through. We have, as she has mentioned, as Ruchi had mentioned, that we have 8 academies. We train students to make them job ready. Whatever is there in the skill market is required, demand is there. We train the students for those skills. We have a very nice infrastructure of may it be a digital academy or may it be a paramedical academy. And we give that kind of knowledge to the students, and make them job ready. So we are able to make them skills, give them proper skills. I think Dr. Nidhi has joined. Dr. Nidhi?
Yes, sir.
Yes, over to you, ma'am. Thank you.
Yeah, thank you. So I would straightforward come to the, I will be presenting the presentation PowerPoint related to the scope in the healthcare sector. First of all, I would like to say that the healthcare sector is the sector which is also considered as a recession free, where you have always the opportunity in terms of the placement. In 2014, when there was a recession hit, this was the only sector which was recruiting. And this again has been proved that during the last 2 years of lockdown, uh, this was the only sector where there was an actively recruitment going on. So this proves that this particular sector is considered to be as a recession free, where there would be always an opportunity in terms of the jobs and placements. Just allow me 1 minute. I'll be sharing my screen. Someone can guide me. I cannot share the screen, Jaya. I think you stop sharing.
I think, yeah, no, I'm not sharing. Can she be the co-host, please?
Yeah, I have given her the rights. I think she will be able to access it.
Yes.
Just open your PPT. Can you see my screen?
Yes, we can. Thank you.
Yes.
Yes. So basically, I would be taking through directly what is the paramedical sector or allied healthcare professional. Basically, the paramedical services are those services where the professionals are assisting the doctors in specialized area. And this particular areas are divided into three types. One is therapy, then second is in diagnosis, and third is in treatment. Now you would be having in confusion what basically this means. Generally, when we go to the doctor, we see the doctors. When we go to the hospital, we see the doctors. Doctors are supported by the nurses. Then who are the paramedical technicians? Basically, paramedical technicians are specialized in the specified sector, and they would be using the technology in that particular sector to help the doctors. So basically, doctor and nurses, beyond doctor and nurses, whoever is working in that field are called technicians. So the nursing job is more related to the patient care and patient centric, whereas the paramedical job is more towards the technology centric, where we would be using an advanced equipment, advanced technology on patients so that it may help in a better treatment or better diagnosis. So why the scope of paramedical sector is increasing? First of all, the recent pandemic which has occurred has really put a light again on the healthcare sector. And this again emphasized that even the developed countries need to upgrade their healthcare infrastructure. And when we talk about the healthcare infrastructure, it's not only the hospitals or the in terms of the number of beds, but also in terms of the type of and the number of the healthcare resources available. So this has put again light that we need a good paramedical technicians, because if paramedical technicians are well qualified and skillful, then the doctors can concentrate on the core clinical services and not on the allied services. The other reason for increasing the scope is that this is the area which is technology driven, and in healthcare the technology is changing a lot. At one time, the CT scanner, 16 slicer CT scanner was considered as the best CT scan slicer, but now even the 64 slicer CT scan is available. So one which was a good technology before, now it is considered as an outdated. So every day this technology is changing, and nowadays CT, MRI things has become a very frequent thing and very common. So that means the number of testing for such services increases. That means we require more skilled force who can work on this technology. The other reason is life expectancy is increasing. What we mean by life expectancy is, initially the average lifespan in an Indian country was 54 to 55 years. Now it has increased to 65 to 70 years, and we tend to increase this further. No developing country would like that the average lifespan for an Indian population or for their population decreases. It is always considered either it should be stagnant or it should be improved. So if the life expectancy increases, then that means the person who are into the senior citizens increases. That means the hospital services will be always in demand, and so do the resources working in this particular sector. That's the reason the paramedical field again has a scope, because this will be ever ending. This will be always improved and always looked after. Besides this, we have seen nowadays hospitals, we have a multi-speciality hospitals where doctors are not on the payroll of the hospitals, but they are on consultant-based business. So that means the one doctor is attached to 2 or 3 hospitals, whereas the hospitals need a people who are dedicatedly working for the hospital, and that's they fill their particular demand from nurses and paramedical staff, because doctors are changing, or they are, in fact they have a tendency of 3 days to sit in one hospital and 3 days to sit in another hospital, whereas the quality of the services provided in the hospital cannot be completely dependent or reliant on the consultant, but it can be dependent on the healthcare resource workers like nursing and paramedic working in the hospital. So what I mean to say here, in fact in hospitals, The nurses and paramedical staffs are on payroll of the hospital, whereas the consultants are on a retainership agreements. So that means we have a better scopes in terms of the career opportunity in the hospital. There are more need of paramedics as compared to doctors, because we have requirement of almost 64 lakh paramedics to cater to the increasing need in healthcare sector. And this has increased tremendously because of the pandemic. This data is particularly prior to the pandemic. And one of the important aspects of choosing this career is here, this is the career where you would be satisfied when you are saving somebody else's life. So besides earning your uh, uh, monetary benefits or your financial benefits. So this is a very dignified and noble job. Similarly, that's the reason we call doctors and we call nurses. We give respect to the nurses by calling them sisters. Similarly, the same respect is given to the paramedical field, and they are the one who would be saving the life in an emergency as an emergency care technician. So that's the reason this is a field where you would be satisfied and have pride in yourself because you can save somebody else's life. So basically, I will be showing what are the different type of courses available in paramedical sector, and what are the career opportunities going forward. So basically, the paramedical sector generally is classified into three types of the courses. First is a certificate courses or a short-term courses, where the courses are of 6 months to 12 months duration. Then we have a courses of diploma courses, which are of 2 years courses, and then there are degree courses. In certificate courses, there are courses like emergency medical technician, phlebotomy technician, hospital front office and billing executive, and general duty assistant and home health aide. So what does this basically course means? So as the name suggests, emergency medical care technician. This means these are the people who will be trained to quickly respond to a medical emergency and save someone's life till a doctor arrives or nurse arrives. So basically, these people work in an ambulance care. These people work in an casualty department or also in a disaster management. So till the time, if there are any road accidents, these people will be there in the ambulance till the time that particular patient is shifted to the hospital. But we cannot wait that we will not start the emergency till the patient arrives in the hospital. The treatment is started on the site itself. So it starts with the basic thing of observing what was the reason of the assault, how does this accident happen, how you will lift the patient, and how quickly you can start your initial management, because this can save somebody's life. So here basically the person who is willing, who is having a passion of taking the challenges, who want to save someone's life, and who is quick enough to be a responsive in an emergency situation, they can select this career. Basically, the eligibility for such courses is 12th science, and the course duration is 12 months, where 8 months is a classroom theory and 4 months is an observation, OJT or an internship. After this particular course, the person can get job in the ambulance care providers. It can be casualty departments or an emergency medical department of the hospital, multi-speciality hospital. Second course, which comes under the certificate category, is a phlebotomy technician course. Basically, these are also called as phlebotomists. Again, this course has increase after the pandemic, because we've seen that the COVID has quite a growth in terms of increase in number of testing and diagnosis. So if you are tested COVID positive, you are supposed to repeat the test after 5 days, after 21 days. So there are people who comes at home and collect your swabs. So what does mean by phlebotomist? Basically, these are the people who collect the samples. It could be a blood sample or it could be any other sample like a sputum sample, semen sample, COVID swab analysis, any sample. So they collect the home sample, they preserve the sample very well and send it to the nearest laboratory for testing and analysis. This course is of only 6 months, where 4 months classroom theory and 2 months OJT is given. 12th science is the basic criteria for this course. In this, you will be taught about sample collection, sample preservation, and the initial sample handling cases related to various samples which are required in medical lab department. So this course is basically good for people who want to quickly get a job within a short duration of time, and then they want to maybe go ahead in career as a lab technician. So to get a quick job, this is initial placement sort of a course. Lot of opportunities from the partners like pharmacy, thyrocare, Dr. Path Lab. So a lot of opportunities are there with the phlebotomy technician. The next course is Hospital Front Office and Billing Executive course. This is a postgraduate course. This is offered to the graduate person. Again, a 6-month course, but this is a non-clinical course, but very important aspect of the hospital, because these people are the one who would be handling the front office of the hospital or healthcare facility. Nowadays, the very common thing which we observe, if you want to visit a very renowned doctor, you will have to take an appointment. So there need to be someone who need to manage your appointments, who can book the appointments, who can respond back to the doctor at one end and to the patient on the other end. So this course takes care of the front office, and on the other hand, it takes care of the hospital billing, which has become a very complex due to a lot of players involved in health insurance, TPA, and corporate billing. So this is a dual role. This person either can get job in a hospital front office or else in a hospital billing department. So you need to be very well aware of the software which is used in the hospital. What are the billing items? What are the special provision related to the services, healthcare services? So all this is taught in this particular course. A very good rewarding career is promised in this course. From here, you can start in career as an just an executive, but you can go to the level of floor manager to the billing manager and TPA coordinator. So what 3 different type of job roles can be catered from this one particular course. Next course is a general duty assistant course. This is again a short-term certified course. This course can be done by 10th student, 10th pass student. If the course duration of this course is 6 months, 3-month classroom, 3-month OJT. These are basically called as patient care assistant. They would be assisting the nurses in the hospital, and they would be taking the patient hygiene on day-to-day basis. So basically it may include like taking care of patient hair care, bathing, bed making, and all these aspects which is needed in terms of assisting the nurse. These people, the more demand is for these people, because this can relieve to the certain extent the a lot of pressure from the nurses, and nurses can focus more on the core clinical responsibilities. It can also help for the patient who are bedridden and they are home based, like they need to have somebody to take care of them at home. So general duty assistant is one when it is for the hospital, and the same courses is provided as a 4-month as a home health aide for the person who want to get a job in the private home setups or the home health aid agency. Whereas the curriculum about both is the same, the eligibility is same. Basically here you would be taking care of patient care, patient hygiene, and patient assistance in terms of transferring the patient, in terms of hand holding so that the patient don't fall, taking care of patient safety. All this is taken care in this particular course. A lot of demand for this from the hospitals as well as home health aid agencies. There is a demand for home health aid. After this, I'll be taking quickly through what are the diploma courses available in the paramedical field. So first course which I'll be taking is a diploma in medical lab technology. This is one of the oldest paramedical course. In fact, paramedical started with the name as a medical lab technology. Here the eligibility is 12th science. Duration for this course is 2 years, and here you would be taught about the all departments which are there in medical lab technology, like hematology, clinical pathology, microbiology, biochemistry, immunology, virology, serology. So there are almost 12 to 13 specialization in the medical lab technology. So in common lay language, what is medical lab technician? Basically those who are doing a blood testing, a various type of blood testing. It could be related to genetic, it could be related to immunology, it could be related to viruses. Anything which is done with the blood testing and the other sample testing comes under the medical lab technology. Nowadays, no doctor or no hospital will do your treatment without the clinical diagnosis or the pathological diagnosis, what exactly is the cause of disease. In fact, if you have a fever and which is not going for more than 3 days, then you would be recommended for basic blood test. Not only for the pathological diseases, even for the health checkups, a lot of the blood tests are done. So that's the reason. Again, the scope for this will never go down. It is going to increase with the time as the health insurance company is coming up. A lot of corporates are emphasizing on health and fitness and health checkups. So this particular part or sector of the healthcare services is going to improve always, and there would be always a demand of qualified paramedical technicians who can work in the pathology lab. Second course is a radiology technician. This is a 2-year course. Again, the eligibility for course is 12 science. Basically, radiology, as the word suggests, here we use the radiation for the diagnosis of the patient. Similarly, pathology also comes under the diagnosis of the patient. Here, the radiation is used either in the form of X-ray or CT, MRI or mammography. So in this particular course, X-ray, CT, MRI, mammography, as well as ECG. These are the courses these are the subtopics, or these are the sub-courses, sub-modules which will be covered in this particular course. After doing this course, person can get job in an imaging centers, medical imaging centers, either in an X-ray department or else in CT, MRI departments or ECG department. After this, person definitely can specialize with CT or MRI with the short-term courses from other university. So this course has a huge demand because again, nowadays, not only the pathological tests are compensator, it is basically bounded with the imaging testing. Like if you do an health checkup, they'll ask you to do the blood test as well as a normal X-ray is needed. Similarly, if you want to conclude on the COVID, you will have to do the swab testing along with the CT test. So these are the things which will be always needed to confirm the diagnosis. So this is again in a huge demand and very good course in terms of getting a career. Third course, which is into the clinical field, is a operation theatre technician course. This is a 2-year course which can be done by 12th science. This course is specifically for the person who want to be a surgeon but somehow could not become a surgeon because of some other reasons. They can take this course. Here you would be assisting the surgeon and you would be a part of a surgical team. You would be handling the patient in a critical condition. You should be courageous to see what is happening with the patient, the bleeding of the patient and all these things. But you would be very happy to see the end results of the surgery if the patient come out of this very well. So this particular course has a huge demand because all the good surgeons, anesthetists, they need a good right hand or left hand for them to help them during the surgeries. And in fact, without them, they cannot perform. So this particular course includes subjects like equipment care, the emergency drug use in OT, the medical legal aspects of anesthesia, consent taking, all this is taken care in this particular course. So basically you would be hired in a multi-specialty hospital in OT setup for patient preparation for the surgery and pre and post-operative care. The next course, which is again in demand, is a dialysis technician course. This word indicates that these people will be taking care of the patient who are on dialysis. Basically, dialysis treatment is given to the patient whose kidney is not working, and this dialysis or hemodialysis acts as an artificial kidney for a time being. So this particular process is a time consuming process. Once the patient is put on the dialysis, it takes 4 hours, minimum 4 hours to complete the dialysis. No nephrologist will have such huge time to spend on one patient. So they need a technician who takes care of when the patient is put on dialysis. So this person will be taking care of pre-dialysis setup, taking care of the patient monitoring during the dialysis. Any complication arises of dialysis will be taken care of by them and informed to the patient. Infection control practices which should be followed during the dialysis. All this is taken care by this particular dialysis technician person. Nowadays, since diabetes is increasing, one of the major complications related to diabetes is kidney failure, and these people go on dialysis. So that's the reason you might be seeing lot of dialysis centers and setups are coming up. So basically, you would be either working in dialysis machine setup or in the multi-speciality hospitals dialysis center, or also in home setting dialysis. As of now, whatever courses we have seen, diploma courses that was into a clinical field, one course which is into a non-clinical field in the paramedical department is a medical record technician. This course has a huge demand, but unfortunately very less awareness among the youth. Basically, this course is for the maintaining the medical record of the patient at the hospital level. This is basically related to that, but nowadays the medical companies who is taking care of the entire health record management for the person. So this course is of 2 years, which can be done by any 12th stream. It can be arts, commerce, science, because here you are not giving any clinical services to the patient. In fact, you would be in the back office of the hospital, taking care of the medical files, and your job would be to, digitalize the medical file, to do the ICD coding, that is medical coding of the files, medical classification of the files, and in the later stage or in the after 2-3 year experience, you can do the analysis related to data which is collected from the hospital or even at the public level, because this is the responsibility of medical record technician to record whatever epidemiological data is there that is conveyed to the local municipal office. For example, number of childbirth given in an hospital in a month, or else even if you take a recent example, if our hospital is giving immunization, how many COVID patient has been immunized on day-to-day basis, this need to be given to the local authority through medical record technician. So these are the various courses which are available with us and which are also falling under paramedical per se. What are the reasons you should offer, and what are the things you should look for in a college when you're selecting a paramedical course? You should see that it's not only the theoretical course, but there is also a well-equipped, sufficient infrastructure or laboratories to take care of, to give you a handhold on the all the medical procedures. So in Tech Mahindra Foundation, we have many laboratories which are well equipped, and it is as per the norm of NABH hospitals. It is equivalent to that. There are many guest lectures which are coming here from healthcare industry, who are giving an advanced clinical protocols, webinar and sessions on the clinical procedures. We have a very good academic council committee which is updating our healthcare curriculum on every annual basis. It's not a 2 years or 3 years old management. Every 12 months we upgrade the syllabus. We provide you an internship in prominent hospitals. So we are tied up with a lot of hospitals. Like for example, in Delhi, we are tied up with Max Hospital. In Mumbai, we are tied up with Fortis, BACS. We are tied up with Holy Family. So Asian Heart. So you will get an internship in renowned hospitals. Our vision is only a placement through, our vision is employment through education. So obviously we will give you 100% assurity of giving you a placement assistance. We are also certified by the healthcare bodies, like we are certified by Indian Medical Association in Delhi, and we are certified by Healthcare Sector Skill Council, Life Sector Skill Council for all pan India location. And for Maharashtra academies, we are also certified to Maharashtra State Board of Skill Development. So these are the things which are there. We also give you a reference book which is developed and designed as per the national occupation standards. I'm just quickly taking you through the basic infra which we have in all the labs, whether you are visiting a Delhi, whether you are visiting Mumbai, Mohali, any academy, you can see the medical equipments which are there in this picture. So these are the picture of basic skill lab. The first thing you are seeing is the person is trying to do or practice a CPR on the basic mannequin. This is a picture of an ambulance where this is used for emergency medical technician course, where you would be trained to transfer the patient from one place to another to take and give the oxygen therapy till the patient arrives to the hospital. This is an operation theater lab. If you see these pictures, you cannot make it out whether this is an academy lab or whether this is an hospital lab. This is as well equipped as in the hospitals. You can see that there is a provision and coloration of as per the ABG medical gas in the OT room. And also you can see that we have a defibrillator, crash cart, suction pump, everything ready in the OT lab. This is a dialysis lab. Dialysis lab, we have two machines. You can see there is a bedside panel, which is also equipped with the oxygen care and the medical gas. There is a patient monitor, bedside patient monitor. We also have an RO system, which can be used for the dialyzers and dialysis machine, which is not shown in the picture, but we have RO system in all the labs. Besides this, you can see this is an X-ray lab. In fact, the X-ray lab is very well protected with the lead sheets just to take care of there are no harmful impact of the radiation. Many smaller clinics may not have, but we take care of all the radiation safety protocols, and it is as per we have an certificate, quality certificate from AERB. On the right side, you can see the IT lab. IT lab, basically, any course you enroll, any course, we not only give the technical skill, besides technical skill, we put lot of emphasis on the foundation skills, which include the basic computer knowledge, communication skill, and as well as a soft skill, because these skills are needed for you to be a job ready or for placement ready. So we inculcate that from the day one, so that once you complete this course, you get the job. These are ideal classrooms, and on the left side, you can see the cafeteria and the happy faces of our students. These are the placement and OJT partners across pan-India. This is a mix of all the academies where we have top hospitals on our board list like Fortis, Moolchand, Sai Gangaram Hospital, Max Hospital, Asian Heart is there, also Medicover Fertility, and even Health India TPA. So we not only catering to the hospitals, but also to the allied healthcare TPAs and healthcare institutes. These are the few placement stories which we have. The initial placement stories we started when front office billing executive. You can see our students are placed in a renowned hospitals like Narayana or SRCC Children Hospital, Apollo Hospital, and Holy Family Hospital. So that's it. Thank you from my side. If there are any question, I would be happy to take up. I would be stopping sharing my screen.
Thank you so much, Dr. Nidhi. That was a very insightful session. Thank you so much once again. And before we wind up, if any of our participants have any queries related to what was discussed, you all can go ahead and post it on the chat box. Okay, so I don't think there are any questions that are being posted. Of course, the acknowledgement of a great session. Okay, so thank you so much once again, Dr. Nidhi, Ms. Ruchi, and Ms. Jaya for this amazing session. We will be winding this up now. Thank you. Thank you to all the participants. Please be home, be safe, and keep smiling.